Good morning everyone, and welcome back to another day in the life video. I didn't end up recording yesterday on Saturday just because I needed a day to recover after having our ice experience for 2 weeks and working at the same time. But convenient enough, I'm heading off to work right now. I'm going to be working 10 hours today from 7 a.m. until 5 p.m. and we're heading back to classes this week. So I'm going to utilize all of this time that I'm going to be at work to really get a bunch of the pre-work done right now. Yesterday, pretty much all that I did was I went wedding dress shopping with my girlfriend's sister, as well as got to go to Anderson Farms, which is kind of like a super fun, like haunted maze type of thing that you can go to, and it was really enjoyable outside of the fact I just got used as a shield or an offering to everything scary by my girlfriend, but we'll move past that. So I'm going to head off to work and open up right now so that way I can get a lot of stuff done. Well, that's the classes done for today. This morning we were in musculoskeletal conditions, kind of getting an intro into temporomandibular disorders, and then in the afternoon we went into our neuromuscular conditions and talked about locomotor training within the spinal cord injury population and just kind of what the evidence says on that and what's being done at places like Craig Hospital, which is one of the specialists in spinal cord injury and brain injuries that is here in Colorado. So it was a very interesting talk overall. But now tonight I have to start working on the pre-work for tomorrow, and maybe if I have time for the rest of the week, I for sure have to at least get done my pre-work for professional development as well as movement science for tomorrow. So I'm going to head off and do that now. Well, it is 4:57 right now. I'm all done with class. This morning, we started off with professional development, where we talked about the profession as a whole, as well as the APTA core values and how we can kind of balance our own needs with also meeting the needs of our patients to the best of our abilities. Then we moved on to clinical reasoning in the late morning, where we kind of took the information from one of the patients that we experienced within our ICE experience and thought up of some questions that we wanted to search within the literature in order to understand things a little better and be able to treat that specific patient population better in the future. And then in the afternoon, we had our movement science 2, where we really started to kind of review what we did in movement science 1, kind of the gait cycle, being able to look at task-related determinants and things like that to just set ourselves up well for the rest of the semester. But tonight I'm going to try and knock out as much of the remaining pre-work that I have for the week as possible, some of the quizzes that I know that I can do since I'll have time. So there's lots to do, and I'm gonna go there now. Well, it's been a packed day so far, full of lots of information. This morning we started off with musculoskeletal conditions where we kind of went over our temporomandibular disorders, which is pretty much your jaw joint right there. That's pretty much what the focus was on. As you saw with my partner Umaru had his fingers in my mouth doing a bit of our anterior glides, our distractions and things like that on the joint there. So it was a really interesting morning overall. We did kind of a skills check along with it to kind of test our knowledge. But then in the afternoon, we had our debrief session for our integrated clinical experience 2 that we just finished, which went really well overall. I actually feel very appreciated after our faculty members who are on the clinical education team actually took the time to say how much they appreciate what I'm doing so far as the clinical education representative for our class. And it seems like my class is also very appreciative of it. So I'm very thankful that the work that I'm doing is being seen and that everyone appreciates it. So it's going to encourage me to do it even more and make sure that everyone is very successful in their clinical experiences. I sent out a feedback form for our integrated clinical experience 2 that went out just a little bit ago. But then right after that, we had our first information session on our clinical experience number 3. So clinical experience number 2 is coming up in January, but clinical experience number 3 isn't until our last semester in the fall, next fall of 2024. So there was lots of information to go over, still lots that's kind of in the air, but as they start posting things more and as we start to look through our sites and sift through the ones that we want to apply to, we'll have a better idea of exactly what's going on. So lots of information to sift through, but now I have about 2-hour break. It's 3:30 right now. So I am going to spend the next hour and a half or so trying to complete the rest of the pre-work that I have for tomorrow for professional development. And then I am going to a pelvic floor student interest group meeting, which is kind of talking about some of the pelvic issues that endurance runners run into. So that will be a very insightful kind of discussion as well as hands-on experience that I'll get to go to. And then I'll end off the night just hanging out with some friends for our weekly bachelor night. So I'm very excited and I'm just gonna get ready.
Us together. We learn all of this and so much more with ferocious minds and open hearts. We are the movement experts.
I'm all done with class for the day. We started off this morning going to professional development where we really just kind of talked about the history of the profession of physical therapy and kind of talked about our elevator pitches. And you saw part of one of them, which was kind of an interpretive dance that went along with it. So it was just a very fun morning overall. And then we moved into clinical reasoning where we moved on to appraising articles for our specific patient cases that we're kind of doing some more research on specific interventions for one of the interesting patients we had during our integrated clinical experience 2. So we made good progress with that. We're actually already starting on the presentation. So we're ahead of the game and I'm hoping to stay that way. And then in the afternoon, we had movement science where we kind of talked about prosthetics and amputees and just talking about the fitting, what classifications of individuals fall into having each of those prostheses. So it was very informative overall, but now I'm heading off to work. I think I'm going to try and finish the rest of the assignments for the week so that way I have nothing to worry about tomorrow, as well as possibly looking at next week to get ahead a little bit, just because I think I'm on top of the game right now and I want to stay that way throughout the rest of the semester. So I'm going to put in lots of work now to keep myself that way. Well, that brings us to the end of another video. Overall today, I pretty much just had an advanced transfer lab this morning in regards to patients with spinal cord injuries, which was really useful, a good review and really kind of reframing exactly some of the things we've learned in the past into how it can be applied clinically. So it was very interesting and very useful overall. Then in the afternoon, we had our last class for psychosocial aspects of care for this semester. And then I went to a climbing specific, just student interest group meeting for the AA-OMT student interest group. It was pretty interesting overall. I had a few things I could glean from it that is climbing specific to really think about. I didn't end up getting a video of it, but then pretty soon after that, I headed off and just went to dinner for an engagement that's happening on my girlfriend's side of the family. So very fun way to end off this week, but that's really all that I have. Next week, we're going to be hitting some of those same classes, really grinding through the material that we have left in our track courses and just finishing off the semester strong. I'm probably going to start thinking about making my studying materials for the rest of the semester so that I can get a head start on that. If you want to see that, make sure to check out the video next week. If you enjoyed this one, please make sure to like and subscribe down below. Thank you all so much for watching. This has been KB DPT, and I'll see you all in the next video.